Is your neck pain causing your headaches? You may be suffering with neck pain that's leading to headaches, and you may know, oh yeah, my neck pain starts and then the headache starts. However, you may be suffering with referred pain, which is when you may not know that you have neck pain. You may have neck tension that doesn't show up as pain, but it does show up as headaches. And usually people who are suffering with this have been to the doctor, they've tried everything, they've checked their blood levels, all of that stuff, and the doctor's like, well, I don't know what's causing your headaches and I can't tell where it's coming from. If that's you, then this video is for you. I'm Dr. Amy with Physical Therapy for Everybody, and I have been seeing many patients in the clinic recently who are coming in with headaches that they've seen everybody, they've done everything, and they haven't had relief from their headaches yet. Some people suffer with headaches because of things like hormonal imbalances or food intolerances, and that's not what we're going to talk about today. What we're going to talk about is those people who have already looked into all that and found out that that's not what is causing their headaches, and they're really frustrated and stuck because they don't know what the next best step is. I will tell you right now that the next best step is finding a specialist who can help understand how your neck, either motion or pain, is leading to your headaches. And the process that happens through is called referred pain. So you may have heard previously that if you're having a heart attack, you may have left shoulder pain. If you're a man, it may be right if you're a woman. And you're like, I don't really understand how shoulder pain is a sign of a heart attack. Well, it's because of referred pain. So what happens is that all of the nerves send messages into the spinal cord, which then goes up to the brain. Now, the brain is pretty smart overall. However, it's not really smart when it comes to pain, because what it knows is that there's pain in this distribution. So if we're talking about the heart, it's T4. So it says, oh, there's pain at T4. Well, T4 covers part of the shoulder too. So it just kind of sends out a signal. It's called a nociceptive signal, an irritated signal. And it says, there's pain over here. And really what it is it's a sign to get your attention in the case of a heart attack, so you can go get medical attention. How does that translate to neck pain and headaches? So the neck has the same distribution as a lot of the head. So what happened? The key point is that the cranial nerves, which are the nerves that go through the head, actually inside the head and across the face, are all located at the base of the skull. And all of those cell bodies are sitting in there, which means if they get irritated for any reason, that they can cause headaches or even facial pain. So you can have pain in your face, it can even be in your teeth. That's actually coming from the cranial nerves, as opposed to from the specific location where you feel like it's coming from. That's what's called referred pain, when you have pain that's coming from one region, but it's showing up in another region. So what can cause referred pain? The primary thing I see in the clinic is trigger points in muscles. So trigger points are hyperirritable bands of tissue, and they often refer pain to other areas. In the clinic, what I do is find those trigger points, and then I can squeeze them in between my fingers, and the patient will say, oh yeah, that's my pain. Even though I'm squeezing maybe somewhere here in their upper traps, they get pain in their head. They're like, oh my gosh, that's my pain. How did you find that? Because I knew that there was a trigger point that was referring pain. But then we need to treat the shoulder or the trigger point so that it stops referring pain. We don't need to be treating the head in that case, because the head is not actually the problem. Another structure that can be referring pain is the facet joints. So the facet joints are in between the vertebrae. They're located throughout the spine, but for right now we're talking about the ones in the neck. And these can also refer pain up into the head, causing headache type symptoms, even though the problem is lower down in the spine. And the last thing I see that can cause referred pain is the discs. So the discs are in between the vertebrae, and they can get compressed, they can get herniated, they can get ruptured, and they can put stress on the nerves that are close to them, but that can also refer pain up into the head. Now, You may have pain that wraps around the side, kind of like a headband. You may have pain that goes over the top to the eye. You may have pain that comes around more like the ear. You may have general headache that you're just like, my whole head seems to hurt. And it's important to work with a specialist who understands how all the different tissues talk, as well as their referral patterns, so that you can actually get treatment for what the problem is, as opposed to getting treatment where the pain is. Now, I will say, if you are working with a specialist and they're working on your shoulder, and you're wondering why they're working on your shoulder when you have headaches, it is totally a great idea to ask questions and say, hey, I'm curious, why are you working on my shoulder when I am having headaches? Because then you'll learn more about your body, and any specialist would be happy to explain that to you. We love being able to educate people on what we're doing and why we're doing it. Plus, it will help you to know for the future. So I love it when patients ask me questions, and I try to proactively answer them beforehand, but sometimes I just forget. I get busy. I'm working with my hands, but not necessarily talking about that to the patient. So if you're wondering ever why your specialist is working on one area of your body when you have pain in another area of your body, definitely ask questions. They are always welcomed and always appreciated. So why does this referred pain pattern happen in the first place? Most commonly, what I see where I'm located, which is in the Seattle region, is a lot of people who sit all day at their computer and don't have really good posture. So this causes increased pain because they're not in the correct position. So if you spend a lot of time on a computer, or looking down at your cell phone, or reading a Kindle that's down here, definitely going to encourage you to lift things up and make sure you're in the correct posture throughout the day. Another thing that can cause referred pain patterns is when you're doing repetitive motions. So people I have who work in more of a warehouse type setting, or even in a trades position where they are having to do things repetitively, this can often lead to trigger points, which will lead to those referred pain patterns. So it's not so much that they have a trauma or an injury that causes pain. It's just this repetitive stress over time that has led to these issues. And of course, you can have referred pain from previous trauma. I see this commonly, that people were involved in a motor vehicle accident or had a traumatic incident when they were a child that caused some trigger points to develop or some repetitive positioning to develop. And this doesn't show up for years to come. And people get really confused about this because they're like, well, that happened, 20, 30 years ago, and I was fine. 2 weeks later, I was fine. 3 weeks later, I was fine. They may not have even gotten therapy for it, but they may have and thought that they totally healed, that they had 100% healing and they were fine. Friends, I'm going to tell you, a lot of times we don't get the treatment we need when we're younger because things start feeling better. And both the therapist and the patient think, oh yeah, everything's fine. It's not a problem. And it's not when you're young. It's not when you're a teenager. However, as we age and we get to be over the age of 40, 50, and 60, our bodies start to take the toll because they've been doing these repetitive patterns for a long time that are causing trigger points and causing muscle issues and causing joint issues. And all of a sudden, it's coming to pay its price. So if you have any previous trauma in your history, I definitely encourage you to talk to your specialist about that to make sure that they understand what happened during the traumatic incident, as well as any treatment that you may or may not have done, because that may have set the stage for what you're suffering with now. And friends, I would be remiss if I did not discuss stress and how it's contributing to our neck pain, to our referred pain patterns, and to a lot of issues that we have in our lives today. In the world today, we are busy, busy, busy. We are go, 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 24-hour news cycle. So we're constantly getting bombarded with bad news. And it is stressful. So all of that really causes a lot of neck tension. In fact, I recently had a patient come back who I hadn't seen for years. She had been doing fantastic and having no problems, but she had a series of significant family life stress issues that caused her neck pain to flare up and get horribly bad. She wasn't able to sleep. And as you all know, when you're sleeping is when you're healing. So she couldn't sleep. She couldn't heal. She needed to come back in and get things worked on. And yes, she did have mechanical issues that we could work on. But part of what we had to talk about was what was the stress that caused this in the first place. Stress can flare up pain like nobody's business. So that's an important thing to work on trying to manage too. So what do you do if you suspect that it's referred pain that is causing your headaches? The first thing I want you to do is work on your posture. You need to make sure your head is over your shoulders are over your hips, and your hips are over your feet if you're in standing, with equal weight bearing through both feet. If you do not have proper posture, there's no way for that referred pain to go away. The next thing I'm going to have you do is some light stretching. You want to make sure that when you're stretching, though, you are only having stretch pain. You are not having pain. I have some patients who are like, oh, I need to stretch that trigger point out. I will tell you, trigger points do not stretch on their own. They have to be manually manipulated. You're going to need help with that. However, you can stretch the muscle around it, which will decrease tension to the trigger point. So be gentle. And if you ever have pain with any stretching, I want you to stop. Stretching should feel good, and you should feel more mobility afterwards. So if you do a stretch and you hold it for 10 seconds, and then you get up and you're like, oh, I feel like my neck's locked up now, that was too much stretching. That's not what you should be doing right now. So 1, feel good. 2, more mobility. And my final tip, if you believe that referred pain is what is causing your headaches, is to get help from a specialist, because you need to understand, A, exactly where your referred pain is coming from, because everybody's different and your referred pain is not just like everybody else's, and 2, what it is you need to do about it, including 3, tips for long-term maintenance. You need to have a plan to make sure that this problem doesn't come back in the future. So I encourage you to find a specialist who's able to diagnose your problem specifically, because it's different than everybody else's. I can provide some general information here and give you some tips, but I don't know you and your body specifically. So I definitely recommend getting together with a specialist who's able to look at your body, do a full evaluation, and tell you exactly what's going on, which includes answering all of your questions. And if you are ever working with a specialist anywhere in healthcare and you feel like your questions are not welcomed and are not answered, I encourage you to find a new specialist to work with, because your specialist should always be willing to try to explain things in a way that you can understand, because you're the one who has to take care of your body in the long term.